Hi, it's Bree Smith, SN, here to help you succeed in nursing school and on the NCLEX.
In this video, we are covering immune pharmacology. We are covering a wide variety of drugs, so check the chapters and timestamps to help you find specific ones you are wanting to focus on. Let's begin. There are many chemotherapy drugs for us to cover, so buckle up. But first, let's cover some general considerations before focusing on more specific medications. Overall, chemotherapy is highly specialized. Our review will touch on some major points for nursing competency and NCLEX, but anticipate a more in-depth education with these meds should you go into oncology. With chemotherapy, often combination therapy is indicated. Infusion of multiple classes and types of chemotherapy medications can provide greater coverage and ability to interrupt the proliferation or life of cancerous cells. Chemotherapy medications open the door for other complications, however. Chiefly among these is myelosuppression, which can lead to complications such as anemia, thrombocytopenia, and neutropenia. Patients on chemo are often so immunocompromised as a consequence of neutropenia that even minor infections can be deadly. Therefore, the nursing priority is to prevent infection by adhering to neutropenic precautions. The priority is also to monitor for and report indications of infection so that the patient may be treated. Another complication to consider as cancer cells are being killed is tumor lysis syndrome, where the toxic metabolites of cancer cells are released as they are killed. This can lead to hyperuricemia, hyperkalemia, hyperphosphatemia, and hypocalcemia. The nursing priorities when this condition emerges include correcting electrolyte imbalances and maintaining renal perfusion to facilitate the excretion of the metabolites. The first chemo drug we will turn our attention towards is cyclophosphamide, a non-specific alkylating agent, which can treat cancers such as leukemias, lymphomas, and solid tumors. Common side effects for the drugs we will cover include nausea and vomiting, alopecia, and neutropenia as bone marrow suppression occurs. Nursing considerations should involve pre-medicating the patient with antiemetic medications and enforcing neutropenic precautions if the patient's white blood cells are below normal range. Cyclophosphamide can be highly nephrotoxic, with the severe complication of hemorrhagic cystitis occurring with renal toxicity. To try to lower the risk of this occurring, patients on cyclophosphamide may receive a drug called Mesna after chemotherapy, which acts to detoxify. To remember this, I like to think how the chemo process for cyclophosphamide is like a cycle: antiemetic, then cyclophosphamide, then Mesna. Next, we will focus on cisplatin, a platinum-derived non-specific chemotherapy medication. Like other chemo drugs, recall that side effects will include nausea and vomiting, alopecia, and bone marrow suppression, which increases overall infection risk. Also of note with cisplatin is the potential irreversible ototoxicity and nephrotoxicity. Assess the patient for changes in hearing status, such as tinnitus, and avoid combining with other ototoxic medications such as furosemide and aspirin. It is important to only give this medication through IV. You've heard of the phrase, "I've got gold running through my veins." In this case, switch it to platinum running through your veins. Now up is an anthracycline called doxorubicin, which provides anti-tumor antibodies. This medication is often the first-line treatment for breast cancer and is often adjunct to other combination therapies. This drug carries with it the risk for superinfection, as the patient's bone marrow is suppressed and the normal microbiome is altered due to the antibiotic properties of this medication. Therefore, it is especially important to initiate neutropenic precautions. Doxorubicin is called the Red Devil due to its unique and severe side effects. While on this medication, secretions such as urine and tears may turn red. This is a non-concerning finding, and patient education should emphasize this. What is a concerning color change, however, is the presence of pink, frothy sputum, which can indicate heart failure. Doxorubicin can be cardiotoxic, and patients' heart function should be monitored throughout the duration of treatment with this medication. Furthermore, this drug carries the risk of hepatotoxicity as well. Assess the patient's liver function tests and monitor for indications of worsening liver function, such as jaundice, ascites, and changes in orientation. Vincristine is a chemo drug that is commonly given in the treatment of pediatric cancers. There are many things to consider with this medication, the first being that this medication should only be given through IV route, otherwise fatality may occur. Additionally, vincristine toxicity can present as peripheral neuropathy. Assess the patient for paresthesia and altered peripheral sensation, and report these findings to the provider. A common side effect in pediatric patients is constipation. Constipation, if unresolved, can lead to more severe complications such as bowel obstruction and perforation. Therefore, increase fiber and fluids and anticipate administering stool softeners or laxatives for these patients if indicated. In this section, the final medication we will touch upon is interferon alpha 2A and 2B. These medications are called biologic response modifiers, and in addition to cancers, can be utilized in the treatment of HBV and HCV, with interferon alpha 2A for both types, while alpha 2B is only indicated for HBV. With these medications, bone marrow suppression is a complication, and flu-like symptoms may present during treatment. Initiate neutropenic and bleeding precautions if CBCs display abnormal values. Continuing with our chemo drugs, this next section will focus on chemo drugs which impact hormones in order to treat certain cancers associated with hormonal abnormalities. If you watch the Reproductive and GU Pharm video, some of these names may be a bit familiar. First on the list is leuprolide, a gonadotropin-releasing hormone agonist, which can overall lead to the reduction of estrogen and testosterone. This makes it useful in females for the treatment of endometriosis and dysmenorrhea and indicates it for the treatment of prostate cancer in males. Complications of this medication include infertility and the induction of synthetic menopause in female clients. Patient education should emphasize incorporating weight-bearing strength exercise and increasing vitamin D and calcium intake for these patients. Male patients should be made aware that initially, testosterone may increase with therapy, leading to worsening symptoms. However, after a couple of weeks, these symptoms should subside and improve as hormone levels begin to decrease. Tamoxifen and raloxifene are selective estrogen receptor modulators, which indicate them for the treatment of certain estrogen-dependent cancers, such as breast cancer. Adverse impacts relate to the impacts of estrogen in the body, and patient education should focus on recognizing and reporting signs of thromboembolic events. These SERMs are also associated with endometrial proliferation, increasing the risk for endometrial cancers. Patients should monitor for abnormal and painful bleeding, and be sure to report these findings as they could potentially indicate malignant endometrial growths. Flutamide is an androgen receptor blocker, indicated for the treatment of prostate cancer. Decreased androgens in the body can lead to side effects such as feminization. Patients should be monitored for indications of hepatotoxicity, with baseline liver function tests compared to LFTs taken during treatment. Assess for indications of liver failure, such as hepatomegaly, jaundice, ascites, and changes in level of consciousness and orientation. Anastrozole is an aromatase inhibitor, aromatase being an enzyme involved in the conversion of androgens to estrogen. This makes it useful in treating estrogen-dependent breast cancers, as estrogen levels are reduced. Like our other estrogen-modifying medications, patients are at risk for complications such as osteoporosis, and should be advised to increase vitamin D and calcium intake, as well as to incorporate weight-bearing activities into their routine. Patients may also be advised to pre-medicate with acetaminophen, as analgesia may be required to combat the side effects of muscle pain and weakness that can occur with this medication. The final medications we will cover in this section are the monoclonal antibodies, trastuzumab. Monoclonal antibodies act as exogenous antibodies, stimulating the same impacts of antibodies created by the host immune system. These can target cancerous cells which present with specific antigen identifiers, making this medication useful in the treatment of HER2 metastatic breast cancer. This medication carries risks of some significant side effects with it. As immune cells are impacted, cytokine release syndrome may occur, leading to severe flu-like allergic reactions, which include rash and dyspnea. This medication can also be cardiotoxic, and therefore patients' heart function, rate, and rhythm should be monitored. Avoid combining with other cardiotoxic medications such as the Red Devil, doxorubicin. To close off, we have a couple of drugs to review that are used in the treatment of human immunodeficiency virus, HIV. Enfuvirtide prevents HIV from fusing with human cells and injecting retroviral code. This indicates it for the purpose of slowing the progression of HIV and its development into AIDS. This medication is administered via sub-Q injection twice a day, and patients commonly experience injection site reactions. Therefore, patient education should emphasize adherence and for understanding that injection site reactions are generally non-concerning. Pneumonia is a noted complication, and so patients should be instructed to report dyspnea, cough, increased secretions, and fever. Zidovudine is also indicated for the treatment of HIV and is often combined with other drugs to interrupt retroviral DNA synthesis. The viral nature of HIV means that patients should aim to be adherent to their dosing schedules for medications at least 90% of the time to reduce risk for the virus acquiring drug resistance. Pregnant females with HIV may take this medication to reduce viral load and risk of transmission of the virus to the neonate. Zidovudine has the complication of myelosuppression, aka bone marrow suppression. This leads to pancytopenia, where the patient may experience anemia, thrombocytopenia, and a granulocytosis. If platelet counts are low, adhere to bleeding precautions. When a granulocytosis occurs, the nursing priority becomes monitoring for infection. Even minor infections for an immunocompromised and immunosuppressed patient can be life-threatening if not recognized early. Patient education should emphasize hygiene and ways to reduce risk of infection, as well as promptly reporting any indications of infection to the provider. Thank you for watching this quick review of immune drugs. While this is far from a comprehensive breakdown, the most commonly emphasized points on the NCLEX and in clinical practice are covered here. Please make sure to utilize your assigned textbooks and modules in addition to this review.
Remember to keep studying and keep working hard.